What is unusual in diarrhea in children? First year you have rota infection, chakra is stool, loose water is CD, and then afterwards in the second year you have cryptosporidium, E-tech, now you have Shigella, and you have other uncommon things. But apart from that, what else in the childhood diarrhea? You have systemic infection, commonly throat infection, chest infection, maybe other septic and UTI sort of infections. So infection causes the release of the enterotoxin, adhesion and invasion of the gut. So thereby there is diarrhea. Antibiotic associated diarrhea once upon a time was a much talked issue. Antibiotic kills normal flora and invites the growth of the your pathogenic organism. So thereby at times they can cause diarrhea. And your overfeeding at times has the surface area issue. That can cause also a little bit of loose stool. Primary and secondary disaccharide deficiency. Secondary disaccharide deficiency is common with the usual diarrhea, so-called classical diarrhea. And the primary is the enzyme deficiency. So it has the absorption defect. And your celiac disease, cystic fibrosis, they have their own pathogenicity and can cause diarrhea. So how do you suspect celiac cystic? When there is recurrent sort of diarrhea and unusual course, and you have growth failures, and you have the malnutrition features. You have intestinal subcutaneous viral atrophy. So apart from the primary malnutrition, if you have secondary malnutrition along with diarrhea, think of these diseases. The echodermatitis and enteropathica once upon a time, zinc deficiency throughout the globe has a diarrheal episode of planetary episodes along with this malnutrition, and there are skin changes in the acrodermatitis enteropathica and irritable bowel syndrome. In short, the pediatric counterpart of the adult IBS is quite common in some places, and they have psychological things, and the peptides are said to be curative apart from the diarrhea management. Thyrotoxicosis and a few more diseases, so the secretory tumors can have diarrhea. Giardia, parasitic infection, is also not that uncommon nowadays, and finally the laxative use can cause diarrhea. So malabsorption and then the malnutrition. So then your arsenic poisoning, they also can cause diarrhea. So wide variety of causes along with the classical diarrheal presentation should be kept in mind while dealing with the children with diarrhea.